Good day, everybody. Thank you for joining us. We know that you hear a lot about large hospital systems within the U.S. Amy and I are here to present a different opportunity to you. If you have the desire to serve the elderly as well as some special populations where you can establish longer term relationships with our patients, our families, then we're an organization for you to look into. First, I would like to introduce myself. I am Kelly Rayback. I am a member of our talent acquisition team here at Saber Healthcare. I've been very blessed to enjoy a rewarding career in serving the elderly for 32 years in a variety of different positions. And I would like to have my partner here, who I know as Amy, introduce herself as well.
Hi, I'm Aminata Sojalo, and short form of my name is Amy. And I've been working with Saver when I first came to the United States. I worked with Saver briefly for 5 years. Then I went on and to further careers. But then, of course, I came back with Saber because they are one of the best with the taking care of the elderly, and I decided to come back and work with them. Started off as a unit manager, and now I'm the director of nursing in one of the Saber communities. Thank you. Go ahead, Kelly.
Okay, so we have we're presenting a little bit of a slideshow and visuals for you. If you can go on to the next slide. Just a little bit of information about Saber Healthcare. We were founded in 2001 around Cleveland, Ohio. Since 2001, we have grown into actually 130 facilities and growing. We're growing this summer and purchasing additional communities within the state of Pennsylvania. Currently, we're in 7 states. We're in Ohio, Indiana, Pennsylvania, Florida, Virginia, North Carolina, and Delaware. Our main goal is to develop an innovative approach to senior care by giving the patients personal needs and attention that they deserve, because we know everybody has a little bit different needs and whatnot. We have about 10,000 employees within those 7 states. We feel that we are in partnership in serving the elderly by providing high quality care that helps improve our patients and their families' lives. So we take it very, very seriously. And we do offer a variety of different services. I'm sorry, can you go back a few slides back to the map? So this is a map. We're mainly on the eastern seaboard as well as part of the Midwest in the United States. We have 1 facility in Delaware, 1 in Florida, 2 in Indiana. We have 25 in the state of Pennsylvania, a lot of them along between Scranton, PA, in the Philadelphia area, but some scattered throughout the state. We have 29 in our state of origin is the state of Ohio, 32 in North Carolina, and 34 in Virginia. And again, we're adding more buildings in Pennsylvania this summer. So there are a lot of different things that make us unique compared to other organizations. First of all, we have a single owner who's very involved and accessible. We believe in personal growth. We always feel that if somebody comes on board with us and they have the desire and passion to grow and learn, we love to support those opportunities. For example, over the years, we have seen somebody who has come in to be a weekend RN grow into a unit manager role, which is a supervisory role over one particular unit, and then going into positions like a director of nursing or administrator. We even have regional roles, be it clinical roles or operational roles as well, that support the buildings. Our company, as I've mentioned, our company is growing, and we're acquiring 20 new buildings this summer in the state of Pennsylvania. We do offer a lot of different programs to our staff. Like, for instance, we have what's called the Leader Up program, which takes individuals who want to develop leadership skills, and we provide them with learning opportunities to become leaders within our communities. We also have things that we have scholarships for individuals who want to further their education. We also have our own staffing agency. So if somebody would like to work in multiple facilities, we do have opportunities there. If somebody moves on to a director of nursing role, which is the highest clinical role you can maintain, such like Amy has in one of our locations. There is a DON council, Director of Nursing Council, it's called. It supports and asks for input by directors of nursing. Our overall company culture is one's about development, caring for those who care for our patients. We do innovative food opportunities. We also do themed activities at our facilities. We're in the middle of around the world type, where there are different activities and different cultural experiences. One of the things that we're most proud of is our Impact Award, which is a monthly award that really recognizes people and our employees in each of our locations that really are stellar and show integrity, motivation, passion, ambition, caring, and teamwork. With that, I am going to run a short clip about this program that gives you a little bit more information. Okay, we might be having some technical difficulties. Are you able to run the video? Okay, well, with that, so Amy, I am going to turn over to my counterpart, Amy, who's going to go over some of our clinical capabilities. And please note that each one of our locations, we do have different acuity levels, such as vents, dialysis, wounds, and IVs, which Amy can speak about.
Yep. In most of our communities, we do take care of people with wounds, G-tubes, trachs, and of course, we have we do have dialysis in some of our facilities or some of our communities, and to take care of anything that you've done. I mean, nursing, like I say, clinically, it's international. You do the same things that you do internationally when you come in here. Those are the same things that you do the right way clinically, and any professionalism. The professionalism, of course, is part of it, and we come in here and we take care of the elderly that we work with in these communities.
Okay, thank you, Amy. This kind of goes over the next few slides, kind of goes over what Amy shared with us. We even have some of our facilities that serve the behavioral health type diagnoses as well. If we can go to the slides that go to our locations, just to kind of give you a high level overview of our locations and the things that they can offer. The state of Ohio has anything from, if you like, outdoors to cultural events, to sporting events. We have a lot of sport teams, to different amusement parks and whatnot. The state of Pennsylvania, if you could go to the photos, I'm on the state of Pennsylvania now. It's a little more, have really some rural areas, again, cultural and activities. Like the state of Ohio, Pennsylvania has 4 seasons. So if you want to experience the 4 seasons, be it fall, winter, spring and summer. These two states in particular experience that. Virginia is very close to our nation's capital, DC, as well as other states. It's around like Maryland and Delaware and whatnot. North Carolina is lovely. You've got the beaches and you've got all kinds of different opportunities where water exists, and some historical, more laid back. North Carolina is in the south, so it's a little bit more laid back than like Philadelphia area, for instance. So we have a lot of different opportunities. We also included a few testimonies from a few of our current staff members. I don't know if we'll have time to go over it, but here we have a gentleman who's in one of our facilities in Virginia. He says that 95% of the employees who leave there always come back because they're working for a family and great place for new graduates. We also have another person who started out in housekeeping, but now she is training to be a nursing assistant.
Wow, that's so impressive, Kelly and Almi. Really, really fun to hear about Saber Healthcare. I know that it is, there's so many opportunities here, so many locations to choose from. Really such exciting opportunities for those who want to work with the elderly, the senior community. Really, really awesome facility. And we are proud to partner with Saber. And thank you to Kelly and Almi for joining us today and for sharing. One thing just to point out that I noticed both Army and I know the other person who came on with the testimonial said, even if we leave, we come back to Saber. That says a lot, everybody. So if you're interested in working with the senior community, please apply to the Connetics USA website. Our team will be on hand to speak to you more about the opportunities at Saber. Thank you so much for joining us, Kelly and Abby.
Thank you, Tanya.
Thank you.
Bye-bye.
Bye-bye.